Alaikum.
Walaikum assalam, sir.
Okay, fine. I think we can start now. Okay. So, কি দেখতে পাচ্ছো স্ক্রিনে?
Male reproductive system 3.
হ্যাঁ, ঠিক আছে। তাহলে ঠিক আছে। তাহলে আমরা last day we were discussing about the prostate. Okay. So let us have a review because we couldn't finish it up properly in last day. So this is the almond-shaped structure named as prostate. This is the almond-shaped structure named as prostate, and this is actually located just below the urinary bladder and above the urogenital diaphragm. This is the urogenital diaphragm. What it is, you know it partially, but we'll be discussing it when we'll be discussing in the perineum. But for now on, you have an idea that this is the urogenital diaphragm. And this almond-shaped structure is a fibromusculoglandular organ. In your book, Visram Singh, it has been written half of the content of this gland, the organ is,
Glandular.
1/4 is fibrous, 1/4 is
Fibromus.
anyway. That is fine. And through it, two important systems makes their way out to the exterior. One is the urinary system, another is the main reproductive system. So up to this, you can see this is for solely for the, this is the urethra. And from this picture you can also see that the urethra has got three parts: prostatic part, and as it is a urogenital diaphragm is consisting of two membranes, it is also called the membranous part. And the rest part of the urethra, which passes through the penis, is called the penile part or the spongy part of the urethra. So from here, actually, this is the common passage for the urine as well as for semen in case of male. And of course, it is in case of male because in females don't have the prostate, females don't have the vesicle, seminal vesicle, or the mechanism like that. Anyways, so this is about the location of the prostate and through which what major structures. Now you can see what is seminal vesicle here. We can see it's a vesicle, seminal vesicle, and this seminal vesicle is actually passing into the substance of the prostate, not directly but as some ducts. What are the ducts? That I'll be telling you a bit later. But for now on, let us say that this seminal vesicle also gets access via some mechanism into the prostate. So if we can, you can now you can see it in other aspect, from other aspect, the true capsule of this glandular structure and a false capsule. The green one is the false capsule, and the deeper one, which is enclosing the prostate gland, is the true capsule. And in between these two capsule is a venous plexus, located deeply seated and very profusely located. Venous plexus is between these two layers, the false capsule and the true capsule, right? And also you can see that there is a gland in the substance of the urogenital diaphragm that is called bulbourethral gland of Cooper, that is located within the urogenital diaphragm space, but it opens into the spongy part of the urethra. But the bulb, actually the bulb of the urethra, so there it opens the ducts. And now we'll be concentrating on the prostate. So that is again shown here. The prostate has got some lobes. I have told you the anterior lobe, the posterior lobe, the medial lobe, and on its side the two lateral lobes. The median lobe or middle lobe is located below on superiorly. It is on above. It is above. It is bounded by the lower border of the bladder, and below by the opening of the ejaculatory duct. And what is ejaculatory duct? I'm coming to that. And and this is the posterior lobe. This is the anterior lobe. And if we see another view, from another view, if we look at, this is the location. And one thing we need to know, that this true capsule is a really capsule which surrounds the prostate gland, but the false capsule is not only contained within to the prostate itself, rather it goes backwards around the bladder. So it's not for only the prostate, but also it is encroaching the bladder and enclosing the bladder, bladder. So this is actually part of the rectovesical rectovesical uh, septum, or and that is actually forming partly the false capsule of the prostate, or the fascia, rectovesical fascia, or fascia of Denonvilliers. That is actually here. This one you can see. If you can see, this one is the fascia of Denonvilliers, which is separating the rectum from the prostate and urinary bladder in front. So you can see the location of the posterior wall of the prostate is very close to the anterior wall of the rectum. That's why parectal examination, or PR, can determine whether the prostate is hard or firm, or it can also determine the whether the median raphe. You can see the median raphe. I'll show you. This is the median raphe. This is posterior median sulcus or median raphe. It is very important for the surgeons, because if the prostate is enlarged due to carcinoma, this is obliterated. This is no more found, and this is a sign that there is a prostatic carcinoma or involvement of the prostate. That's why these can be felt. These raphe can be felt by the surgeon when he or she puts her finger, his finger, through the rectum and touches this posterior surface. Right. So you can understand, prostate is very close to the rectum.
স্যার র্যাফেট আরেকবার বলে ভালো করে দিন।
এই রাফেটা, এটা হচ্ছে এই যে posterior median sulcus, between the posteriorly between the two lateral lobes, এই যে এখানে একটা সালকাসের মতো থাকছে, এই সালকাসটা যেটা, it is normally it is present, but when see why it is present, because the other sides are lower than this, that's why it is high and felt. But when the prostatic content is swollen, then it becomes level with the two sides, and it can't be separated, identified separately from behind. এই যে দিক থেকে আর এটাকে খুঁজে পাওয়া যাবে না. When the surgeon puts the finger, it feels that this has been obliterated. That means the prostate has swollen, and this swelling is actually due to the carcinoma mostly. And if it is hard, normally the prostate is consistency is firm, but it becomes stony hard when there is carcinoma. So these findings help to the surgeons to clinically identify. Then there are so many tests like PSA, prostate specific antigen test, ultrasonogram, and many other things that we can do. But for clinical assessment, this is very good, and no examination of the prostate is complete if the parectal examination is not done. If the parectal examination is not done, actually no prostatic examination is complete. So you must keep it in mind that we can assess the prostate through the rectum. Okay, next, these are the lobes of the prostate. Anterior lobe, as I have told you, this is the posterior lobe. These two are the lateral lobes, and the median or middle lobe can be seen from the previous picture. And interestingly, the anterior lobe has got no glandular substance. That's why some of them say this is isthmus only, that is connect the two lateral lobes. Okay, but there is an embryological basis of these picture, you can see the deeper area in the middle center is actually coming from mesoderm, right? And the lighter area is coming from the endoderm. Okay, so there's an embryological basis of these glandular arrangement and the substance of the prostate. Now let us see how these glandular structures are one. Then I'm coming, as we saw the glands, etc. in the substance of the prostate. So this is the submucosal gland, a mucosal gland, then submucosal gland, and the main prostatic glands, which is lying on the most peripheral part. And usually the carcinoma of the prostate involves these main prostatic glands peripherally, and the mucosal and submucosal glands in the center are actually related with the benign hyperplasia of the prostate or benign enlargement of the prostate. So these substance can normally enlarge, and that is not harmful if it is not blocking the passage of the urine, or else it is very common. It is said that it is very common as the graying of hair of male. You know, most of the males grow, and that is the silver hairs, that is the graying of hair is very common to male. Similarly, the enlargement of the prostate after 50 is very common to male. But if it is not blocking the passage of urine, it is no harm. But when it blocks the passage of urine, then it is cause some urgency, frequency, hesitancy, and many other features related to urine passage. But the main problem happens when the main prostatic glands or the peripheral prostatic glands or prostatic glands proper are involved, and that is actually indication of carcinoma. So what the surgeons do in earlier days, they used to put their fingers blindly, and as I've told you, they had just ripped off the prostate substance from where they wanted to by putting the finger and just blindly getting it back. And that caused huge bleeding because it was supposed to destroy these venous plexuses, and there was huge bleeding. But nowadays the surgeons can approach through urethra, that is called transurethral TARP. This is the term called TARP, transurethral. That means from here they insert a needle, a device which has got a camera and a cutter, and it goes to the prostate and cuts the required part. That is called transurethral retrograde prostatectomy, terms TARP, TURP, and that is very easy to do. I mean, not that easy, but a very easy to do in the sense that related to those earlier days, but still it's a very technical one. But people who have undergone TARP in the morning, they can leave the hospital at afternoon or in the evening. So easy in that sense. হ্যাঁ, তাহলে এই হচ্ছে গিয়ে কথা। এখন আসো, within the substance of the prostate there is an area that is called colliculus seminalis or verumontanum, where the three things open. One is the opening of the prostatic utricle and two ejaculatory ducts. What are these things then? You can see from here there is a prostatic sac, the utricle. It is a sac-like structure within the substance of the prostate, and it is between the anterior posterior lobe and middle lobe is actually located here, which opens in the middle one, and two on its side is for the two ejaculatory ducts from each side. Ejaculatory ducts are nothing but they are the formation formed when the ampulla of the vas deferens, that is the vas deferens, and the seminal vesicles duct unites to form the ejaculatory ducts, and that passes behind the prostate to reach the inner bladder to reach the prostate substance and opens in this colliculus seminalis or verumontanum. On its side is this area, and before that the lining epithelium is one. Here, from here, the lining epithelium, the urethra is different. I have told you there are four kinds of lining epithelium in the male urethra, and that is actually this is a demarcation line that you'll study in histology class, so I'm not going to detail that, but just have an idea that this is the location where two ejaculatory ducts and the prostatic utricle opening is there. Okay, so this is in short about the prostate. And the prostate is very much anatomy of prostate is very important because these venous plexuses are related to the vertebral venous plexuses. So the cancer or carcinoma here can pass to the vertebral plexus, and thereby it can reach the uh, nervous system. So it's very important to know the source. Sometimes the people comes with the problem in the brain tumor, but actually the source is elsewhere in the prostate or somewhere else. So this is something we must keep in mind. Okay, so in short, this is about the prostate. And by that time we have discussed about the seminal vesicle. It's a sac-like structure. It's a sac-like structure which actually is nothing but it's nothing but a convoluted single duct which has got a blind loop at one end and the open end which joins with the vas deferens to form the ejaculatory duct. So this is a single duct actually which convoluted upon itself to form a vesicle like structure. Okay, and you can see from this figure that where it is located. This is the vas deferens and this is the seminal vesicle. Sorry, this is the vas deferens and this is the ureter, and the vas deferens crosses the ureter from lateral to become the medial content to the seminal vesicle, and these two joins to get into the substance of the prostate, right? Now, another one thing, bulbourethral gland of Cooper. And what is the function of these glands? These are accessory sex glands. So, what do? They actually add bulk to the semen. You know, the semen has got only 10% of the semen is the cellular content, that is the spermatozoa and some other cells of spermatogenic lineage. But the 90% of the bulk of the semen is actually formed by the seminal vesicle and these bulbourethral gland of Cooper. And these not only adds to the bulk of the semen, rather it gives nutrition, provides nutrition. Huge amount of fructose and other carbohydrates are provided to the spermatozoa so that they can fly, I mean swim a long way to reach the ampulla of the fallopian tube of the uterus, a female fallopian tube, so that there can be fertilization. So this energy is provided by the the seminal provided by the seminal vesicle and the bulbourethral gland. Okay, but interestingly, you see the location of the bulbourethral gland. As I've told you, it is located within the deep perineal space. What is deep perineal space? You'll not understand right at this moment. Just have an idea. This is the space which holds up urogenital diaphragm. Within that is the deep perineal space, and its duct is actually open into the urethra, spongy part of the urethra. So this is in short about the bulbourethral glands of Cooper. Now let us get to the penis, which is very common in the sense some of the people consider this is the most important male reproductive organ, but from anatomical point of view, from embryological point of view, it is not like that. We consider the primary sex organ of male is what?
Testes.
Which one is?
Testes.
Test, not the penis, because we can take the same spermatozoa from the testis to get the next generation by artificial procedures like test tube baby, right? So penis. Now why, what it is, and what are the parts of it, and what is the importance, and what is the the mechanism for the arousal and ejaculation and emission. These are all things we need to know. So let us start with the location. You can see this is the penis in flaccid state, and it actually can erect when needed, and that mechanism is solely vascular phenomenon. Okay, I'm taking a break for some reasons. Okay, just for a few seconds. Okay. Okay. Acha. Okay. So let us start with this. This is the flaccid state of penis, and as you can see, let me make one thing clear to you. The part which is visible from here, this is the rectum, and this is the part of the penis. So this one thing must be made clear before we start and do anything else. You can see from here, this is the rectum and this is the part of the penis. So we just see this part of the penis that we usually the layman used to say this is actually the body of the penis, but root of the penis is so deep seated. You can see it has almost reached the rectum. This is the rectum. So this one thing must be made clear before we start and do anything else discussion over it. Okay, is it clear to you from this figure how deep it is? Actually we consider this part only as the penis, but this big thing is inside us and almost reaching the rectum and the anus. This is the anal canal, anal opening. This is the anal canal rectus. So rectum. So you can understand how deep it is. Look, actually. Now let us come back again, and see. This is the penis having some parts. I have told you, and before that we need to discuss some points about the perineum. Have I told you something about the perineum? Have I told you?
ডেফিনিশনটা বলছি
যে ডেফিনিশন
আর
আর
লোকেশনটা।
লোকেশনটা। এখন আরেকটু দু একটা কথা পেরিনিয়াম সম্পর্কে আমাদেরকে জানতে হবে, না জানলে অ্যাকচুয়ালি হচ্ছে না। হ্যাঁ, আমরা যতই বলি না কেন পেরিনিয়াম আমরা পরে পড়বো কিন্তু আসলে হয়ে উঠছে না। আমি একটু দু একটা কথা বলি আরো। হ্যাঁ, একটু দাঁড়াও। আচ্ছা, বলো তো দেখি যে পেরিনিয়ামের ছবি আমরা একটু দেখাচ্ছি তোমাদেরকে। এক সেকেন্ড। দেখতে পাচ্ছো? ক্যান ইউ সি?
জি স্যার।
হ্যাঁ, তাহলে দেখো দিস ইজ দ্য পেলভিক ইনলেট। তোমরা হ্যাঁ সবাই দেখতে পাচ্ছ তো? হ্যাঁ, এখন দেখো। আচ্ছা ঠিক আছে। পেলভিক ইনলেট, pelvic outlet সম্পর্কে সবার do you have the ideas about pelvic inlet and outlet? Of course you have, because you have studied the hip bone and pelvis. So you can see pelvic outlet is not the perineal outlet, but in the sense that it's not related to the perineum. So perineum is something here, located here. This area is called perineum. So the lower part of the trunk below the pelvic diaphragm. So this is the trunk's lower part. This is the trunk's lower part that is below the pelvic diaphragm. This is the pelvic diaphragm, which is formed by two muscles, levator ani and coccygeus. These two muscles actually forms this hammock. Hammock means hanging like this. Hammock like structure. হ্যাঁ, ওই যে টম এন্ড জেরি এতে দেখায় না, হ্যাঁ সেই টম এন্ড জেরির হ্যামক গুলোর মতো আর কি। হ্যামক আচ্ছা, হ্যাঁ আরাম করে, রাইট। সো দ্যাট ইজ the thing, and this area is the perineum. And next, this is actually the anatomically, this area is called the perineum. So you can see no discussion of the penis, scrotum whatsoever, or the female genital, external genital organs are possible without knowing the location and the arrangement of the structures in the perineum. So this is actually the diamond shaped area is called the perineum, right? So let us go a bit further like this. This is the boundary of the anterior boundary of the perineum, the two pubic bones joining together, and posteriorly it is the tip of the coccyx, and on its side the ischiopubic ramus and sacrotuberous ligament is forming this diamond shaped area. Okay, so you have seen the perineum. Now let us consider this perineal space into this is the perineum again, and you can see it has got two spaces. This is the deep space and this is the superficial space of the perineum, and the urethra is passing through it. So both in case of both male and female, actually the urethra is passing in. This deep space is that one. That one we have shown here. This deep space is this one. Now you can match it. This is the deep space of the perineum, and this is the superficial perineal space. Now you can understand what is the location. Can you understand? Perineal membrane, and this one is the perineal membrane, not this one. Here you can see two membranes, one is above, one is below the deep space. The lower one is called perineal membrane, and that is here. So we are now seeing it from below. We are now seeing it from below, that the bulb of the penis, this one is the bulb of the penis. It is located and firmly attached to the perineal membrane in the perineal space, superficial perineal space, and also the crus of the penis. So root has got how many parts? I've told you, crus of the penis and the bulb of the penis. And the body of the penis has got two parts. One is let us first identify the parts, then we can go to that. One is that you can see glands of the penis, the most distended and the most distal and the most wide part of the penis is called the glans penis, and it is just behind it is called the corona glandis, where the glands of the penis posteriorly it is forming a rim like structure that is called corona glandis, and behind it it is narrow, that's called neck of the penis. And these these body of the penis has got two substances, from everywhere you can see. This is one type of substance and this is another type of substance. This is called corpus spongiosum, and this is called corpus cavernosum. Actually there are two corpus cavernosum. So why it is called cavernosum and why it is called spongiosum and what is the function of these and how they are arranged, I'm telling you one by one. You can see this is the corpus spongiosum, which extends to form the glands of the penis. So the glands of the penis is solely formed by corpus spongiosum, and it is arched backwards to form the corona glandis, where actually the corpus cavernosum is lodged on its side. You can see it from this picture. These are the two corpus cavernosum and one is corpus spongiosum, and this corpus spongiosum is dilated to form the glands, where actually ends up the corpus cavernosum are joined on and located on its side, above and its side of the corpus spongiosum. বুঝতে পেরেছো? And the urethra actually passes through the whole length of the corpus spongiosum, and it gets its entry into ওই আগের ছবিটা দেখো কোথায় it gets its entry, urethra is getting entry into the body of the penis at the bulb of the penis. So at the bulb of the penis the urethra enters into the corpus spongiosum and passes all the way to the glands, and it's called navicular fossa. That's just before opening it makes a dilated cavity that is called navicular fossa. That's all. And so from here you can see the urine as well as the sperm will pass through the same pathway. Now why it is called corpus cavernosum and why it is called the other things are called spongiosum, you can see there's whitish structure. I'll show you. These are all whitish structures and forming cuboidal spaces. These are called cavernous or cave like structures. That's why this is called corpus cavernosum. And there's no such cave like structures, rather it is sponge like. That's why it is called corpus spongiosum, right? And all these areas are actually filled up. This is venous spaces which are dilated and which are very lax during when the mm, penis is flaccid, but when it is tumescence is needed, then the spaces are filled up by blood and the penis gets erected, right? এখন এইটুকু আমাদের বুঝলাম, we can understand. So what is corpus callosum, corpus cavernosum, we can understand, but how they are fixed to each other and how, what are the factors that holds up these penis. So you can see there are some connective tissue structures. One is this one, which joins the two corpus cavernosum, and there is a medial septum which is tunica albuginea. That is also albuginea, means whitish, though it is not shown in white, but they actually form the substance, and this holds that substance of the corpus cavernosum tight. And another covering for the corpus spongiosum, and both of these corpus cavernosum and spongiosum is covered in a common sheath, that is yet another sheath. This is one. So this is how the substance of the corpus cavernosum and spongiosum are fixed, so that it can take a definite shape, because without any definite shape it can't maintain the shape of its regularity. So these are the connective tissue layers, and out of that these are the skin of the. So we now, if I now come from outside, this is the skin, then is the superficial fascia, which has got some layers and common sheath for the corpus cavernosum, corpus spongiosum, this one, and this one is the common sheath for the two corpus cavernosi, and this one is for the corpus spongiosum. So these skin of the penis is a bit partially overhangs in the glands, and that is cut. This is called prepusal skin, and that is cut during the surgery of circumcision, for maybe for religious purpose or for medical purpose. These sometimes these part is cut, and then these glands is exposed. There are some benefits of circumcision, because the smegma, if it is lodged here for a long time, it may cause carcinoma, and that's why it is widely practiced in Muslims, Jews, and Christians. But it is not finalized that whether this circumcision is a must for everyone. Anyways, we are not going to debate on that, but for religious purpose, we some of the people of some religions, we practice it. So this is about the religious indication, but there are some indications where you need to and must have to do the circumcision, like repeated urinary tract infection. Due to this lodged smegma, it may go inside and cause repeated urinary tract infection of young aged children. So in that case, you must have to do this circumcision. So whatever the reason, we must know, and every student should practice circumcision in the internship so that they can do it, because when you go to upajala level, you might have to do that. And this is the frenulum, and this is the frenulum, and this frenulum is holding the corpus spongiosum with the prepusal skin, and very important because the frenular artery is there, so we have to rightly block this one and have the bleeding arrested from here, or else the frenular artery during circumcision, if it is open, it would cause bleeding. So as we have come to the bleeding, let us come to the one more thing. The glands, in the glands, elsewhere the skin is very lax, so it can move freely, but on the glands it is very much tightly adherent to the substance. Okay, the skin. Now let us come to the point of the blood vessels. You can see deep artery of the penis within the substance, two deep arteries of the penis within the substance of the corpora cavernosa, and two dorsal artery of the penis just between the common sheath and the sheath for the cavernosi on its side, and in the middle there are two superficial dorsal veins and deep dorsal veins. And one thing you must need to know, this side which is continuous with the anterior abdominal wall is called the dorsum of the penis, and this side which is continuous with the scrotum is called the ventral surface of the penis. Okay, so from there you can think, then this is the dorsal area with the dorsal deep dorsal vein in this one, and this is the superficial dorsal vein, and these are the two dorsal arteries of the penis and the deep arteries of the penis, and these are the dorsal nerves of the penis. So you can understand from this figure what is the location. Now let us come to the important thing. The we have already told you the crura and the crus of the penis and the bulb of the penis. The bulb of the penis, as I've told you, it is the dilated part of the spongy corpus spongiosum, and which actually accommodates or the receives the entry of the urethra into the substance of the corpus spongiosum and passes all the way to the navicular fossa, then to the external urethral meatus. And this is the corpus crus of the penis, which is actually continuation of the corpus cavernosum, which passes, and as I've told you, it is issue pubic ramus of the hip bones on its side it is attached to, and there are two muscles, skeletal muscles. One is bulbus spongiosus and another is ischiocavernosus. Ischiocavernosus covers the crura of the penis, and the bulbus spongiosus covers the bulb of the penis. So these two skeletal muscles has got very important role in ejaculation. I'll tell you later, a bit later. So this you can understand about the arrangement of the penis and how it is attached. I've already told you it is attached to the perineal membrane. On its side, the crura are very much firmly attached to the ischiopubic ramus, and the bulb of the penis is attached to the undersurface of the perineal membrane. Okay, so I'm not, and two more things. This is fundiform ligament from the linea alba. It holds up like a loop. It holds up the penis, and this is suspensory ligament from the this is the symphysis pubis. From there it also holds up the, it is the deeper structure than the fundiform ligament, which actually holds the penis in position. Okay, now these are the things that tunica albuginea I've told you. This is a whitish structure, so I'm not going to detail it now. How, let us discuss a little more about the mechanism of erection and ejaculation that you must know, and that is very important to know. I told you the be it corpus cavernous or corpus spongiosa, it is actually venous plexuses, spaces, blood vessels, spaces which are filled up during erection. So this is actually done by parasympathetic sacral 2, 3, 4, that actually gives the through hypogastric plexus it supplies, and this is calling vasodilatation, and there is a huge amount of blood in these spaces which make them filled up, and the and also it blocks the exit of the blood from these plexuses, and thereby it is tumescent and it erects. But the mechanism of ejaculation is done by the sympathetic trunk and sympathetic part, and also by the somatic nerves. So the sensation of sexual arousal, when it is goes beyond control, that is excessive, then it goes through the somatic nerves, and finally it passes to again to the substance of these structures, like the seminal vesicle, the prostate. You know, the seminal vesicle has got some smooth muscle. I mean, there's muscular structures. The prostate has got the smooth muscles. So muscles around these actually are stimulated by the sympathetic nerve and the vas, also the vas, and then the contents of the seminal vesicle along with the contents from the vas deferens goes to the urethra, prostatic part of the urethra. This is called emission. Then finally, when the act is even more, then the final part of the thing happens, that the bulbospongiosus starts to contract repeatedly and rhythmically, and that causes the ejaculation. So this bulbospongiosus muscle has got a very important role in ejaculation, and emission is done by straightway by the sympathetic valves. That bulbospongiosus is also, you can see, supplied by the bulbospongiosus is also supplied by the sympathetic fibers. So we can say that erection is a parasympathetic function, or ejaculation is a sympathetic one, and this has got an evolutionary mechanism. Evolution, you do know what is evolution?
Yes, sir. Biportan, sir.
Bivorton. Actually, these mechanisms are within us from lakhs of years, millions of years. Our ancestors used to live day for day. They used to live hour for hour, minute for minute, because everywhere, every moment there was chance of danger. So whenever they got some rest, they could mate and increase the number of population, but they were always constantly under the threat of dangerous things around them, because they didn't have the house to live. They didn't have, I'm talking about the prehistorical days. I mean, the when the people, you didn't know how to build up houses or to lit fires, right? So in those days, the sympathetic system used to do ejaculation, and the parasympathetic system do for the erection, but that remains within us. So whenever you feel a threat, the ejaculation system starts, the sympathetic system starts. We always know that sympathetic system is for flight, and parasympathetic system is for rest and recreation, right, and digestion, right? So whenever we have the chance to take rest, parasympathetic system acts, and whenever we are threat of anything, whatever threat, be it a real threat, be it a threat in my mind, it will cause ejaculation here in this part. In other parts, it will cause other things like um, urination. It will stop micturition. Say for example, you are a general, and you have ordered your soldiers, fight, attack, and then you say, where is the toilet? Will your soldiers follow you then? If you try to find out the toilet, no, you have to do the fight. Similarly, when you are in danger, you don't need to search, do for mating. Rather, you must do the ejaculation and do the fight to survive yourself. So this is within our gene actually. That's why when the people who don't have the ability to do the there are two problems, premature ejaculation, and one is impotence. Impotence is one that is related to the male system, one which is where the person to do an act of copy, and premature ejaculation one where he doesn't have the right adequate time to continue the copulation. Both are related to these two pictures. If impotence, there's many reasons of impotence. One of the reason may be inadequate parasympathetic supply. So if we somehow can increase the parasympathetic supply of the person, then there would be the completion, or that is the stopping of the problem of impotence. Again, maybe that the parasympathetic supply is okay, but the vascular channels are not functioning properly. So there are some drugs that is now we are dealing with. There are some drugs which can increase the vascular supply to these corpus spongiosum and corpus cavernosum. That also can help. So you can, first of all, when a patient comes to you, you have to assure them that, okay, don't worry. If you worry, it will cause worsening of your situation. So don't worry. Whatever the threat is, you don't take it into your mind. You get relaxed, and we are giving you some drugs which will help you to manage this problem. And if he is not relaxing from within, the sympathetic system will be always acting on, and there would be ejaculation prematurely. So not only the drugs, the counseling is very important for everyone who comes with you to you for these problems. And I'm going to tell it, I have told it in details because this is a common problem where we don't have any solution from a medical perspective. So this is all about the mechanism and the little bit of pharmacology, that some drugs are there which can increase the blood supply to the penis, corpus callosum and corpus cavernosum. There are some drugs which can increases the parasympathetic supply. There are some drugs which can reduce the sympathetic supply. And finally, there are some drugs which can increase the neurotransmitter serotonin. Okay, so because serotonin is one which actually increases the sense of satisfaction and sense of enjoyment, and that helps to nullify the action of the sympathetic system. So there are some drugs which can directly increase the amount of serotonin in blood and thereby reduce these problems. So,
Sir,
yes, please. Time shesh.
স্যার ফার্মাকোলজিক্যাল ড্রাগস কি স্যার মানে হোলসাম সম্পূর্ণ নার্ভাস সিস্টেমের উপর কাজ করে নাকি স্যার লোকালাইজড একটা পার্টিকুলার লেভেল বা একটা স্পেসিফিক কাজ করতে পারে এরকম ভাবে দিতে পারে?
হ্যাঁ, ভেরি গুড কোয়েশ্চেন, ভেরি গুড কোয়েশ্চেন। আমি খুবই খুশি হয়েছে প্রশ্নটা শুনে যে ইয়েস, সাম ড্রাগস আর ভেরি মাচ স্পেসিফিক, but some of the drugs like those increases the level of serotonin. It increases the serotonin all over your body and makes you euphoric, right? So that's not a harm. Indeed, that's not a harm. If you some drugs make you so euphoric, it's not a harm. So at the same time, it is doing helping you to fight back these, or helping the patients to fight back these premature ejaculation and impotence. So you are absolutely correct that there are some drugs which will act generally, but some of the drugs can be specified to act on the genital system as well. Okay, like those one which will increase the amount of blood supply to the penis, corpus callosum and corpus cavernosum. These are very much tailored drugs, like the Viagra and some other drugs. These actually do these things, right? Have you heard these names? I don't know, but if you have not, you'll be hearing it in the fourth year. So these would be discussed in details in fourth year when you will study the pharmacology. But from just have an idea from these, it will be helping you in future when you have to deal with these problems in your practical life. Okay, so this is all about the male reproductive system. There are so many things more, but we can have an basic idea of the male reproductive system if we just follow these basic principles. That means there is the system sympathetic. What is the role of sympathetic system on male reproductive system? What is the role of parasympathetic system? Sorry, this one is the parasympathetic one and this one is the sympathetic one. So now you can understand the basics of anatomical aspects of these problems and the male reproduction, because this is the only system which is unique to the male. The heart is same in case of male or female, the kidneys are same in case of male and female, the all the organs are same in case of male and female. Only this genital system is different for different male and females, right? So we must know these things and what are the problems specific to male, what are the problems specific to female. And from now on we will have the idea that for the problems specific to male we'll go to andrologists, and for the problems related to the female genital system we'll go to the gynecologists. And that is one thing we must practice and help our patients and help our nearby people. And with this, I hope that you be able to be a good practitioner. And we'll also discuss the female reproductive system from this perspective of practicability, because same thing happens. There are so many misconceptions regarding female reproductive system as well, that you need to know and rectify and have the good decisions. Okay, can I complete the class today, finish the class today? আজকের জন্য শেষ করি।
Yes, sir.
আচ্ছা,
Sir, one question.
হ্যাঁ বলো বলো বলো।
Sir, sir, একটা question ছিল।
হ্যাঁ বলো বলো।
Sir, in scrotum, there is a one covering named tunica vaginalis. So my question is, why it is called tunica vaginalis? The word vaginalis, isn't it related to only female?
No, no, no. Vagina is a common term. Vagina is present not only in the female. Vaginal process is a process. There is a sac-like structure that is called vagina. Okay, vagina. We'll be discussing it in female when we'll come to that. So, say for example, অনেক কিছু আছে যেমন falciform. Falciform ligament is applied in many places. The term diaphragm is applied in the diaphragm elsewhere. অনেক জায়গাতে diaphragm ইউজ করা হয় না, সেরকম ভেজাইনালিস, ভেজাইনা বলতে যে শুধু ওই ভেজাইনা বোঝাচ্ছে তা না, ভেজাইনার একটা আলাদা মিনিংও আছে। হ্যাঁ, স্যাক লাইক স্ট্রাকচার দ্যাট ইজ কল্ড ভেজাইনা দ্য স্পেস। তো এরকম যেহেতু তাই এটাকেও টিনিকা ভেজাইনালিস বলা হচ্ছে, কিন্তু এটা ওই ভেজাইনা বোঝাচ্ছে না। তুমি ভালো প্রশ্নই করেছো, আমরা নেক্সট দিন আরো ডিটেলস এটা বলবো। নিশ্চয় বুঝতে পেরেছো শব্দের থেকে এটা আর কি আসলো এটা কিন্তু ওই ফিমেল ভেজাইনাকে ইন্ডিকেট করে নাই। আচ্ছা ঠিক আছে, থ্যাংক ইউ।
আসসালামু আলাইকুম।
Thank
আচ্ছা,
you.
ওয়ালাইকুম আসসালাম। ওয়ালাইকুম আসসালাম।
একটা কোশ্চেন ছিল।
Good afternoon.
আচ্ছা আচ্ছা, বলো বলো বলো। হ্যাঁ,
So what is the plane of enucleation?
প্লেন অফ
Enucleation.
মানে বলো তো কি, এটা একটু বলো তো।
Enucleation. বিশ্বনাথ সিং এ দেখছিলাম।
আচ্ছা আচ্ছা আচ্ছা, এটা আমি দেখছি বলতে হবে কি, আমি বুঝতে পারছি না কথাটা কোথায় আছে বলো তো। বিশ্রাম সিং এর কোথায় আছে?
বিশ্বনাথ সিং এর প্রস্তুতির মধ্যে আছে। স্যার এই ভেনাস প্লেক্সাসে একটা যেটা ছিল।
আচ্ছা, ভেনাস প্লেক্সাস।
প্রস্তুতির
আচ্ছা ঠিক আছে, ভেনাস প্লেক্সাসের মধ্যে ছিল, ভেনাস প্লেক্সাসে। আচ্ছা
ক্লিনিক্যাল কোরিলেশনের মধ্যে।
আচ্ছা আমি দেখছি। হ্যাঁ, আচ্ছা এটা আমি দেখে বলবো তোমাকে। ইউনিক্লিয়েশন, ও আচ্ছা আচ্ছা, মানে ইউনিক্লিয়েশন হচ্ছে যে টেনে যে বের করে ফেলা হয়, ওইটা প্লেন অফ ইউনিক্লিয়েশন, ওইটাই বোধহয় বোঝাচ্ছে।
এটা থাইরয়েড গ্ল্যান্ড আর প্রোস্টেটের ডিফারেন্সটা
হ্যাঁ
বুঝি।
হ্যাঁ হ্যাঁ, ইউনিক্লিয়েশন বলতে ওই যে আমি যেটা বলেছি ওইটাই ইউনিক্লিয়েশন। হ্যাঁ, আমি আসলে শব্দটাই বুঝতে পারিনি। ইউনিক্লিয়েশন মানে হচ্ছে, আমি বলি তাহলে দেখো, এটা এটা খুবই মজার জিনিস। আমি এটা কোথায় আমরা ছিলাম আমি দেখাচ্ছি। এই যে দেখো, ইনিউক্লিয়েশন শব্দটা কিন্তু অনেক জায়গাতে ইউজ করা হয়। ইনিউক্লিয়েশন যদি বলে থাকো, তো আমি আসলে প্রথমে কথাটা বুঝতেই পারিনি। এই দেখো, এই জিনিসটা এইরকম। আমরা এটা ইনিউক্লিয়েশন শব্দটা আমরা অনেক জায়গাতে ইউজ করি। হ্যাঁ, যখন আমরা চোখের ক্ষেত্রে ইনিউক্লিয়েশন শব্দটা ইউজ করবো, চোখের ক্ষেত্রে ইনিউক্লিয়েশন বলা হয়। হ্যাঁ, তারপরে অনেক জায়গাতে। এই যে দেখো, এই যে এটা হচ্ছে ট্রু পেল।
স্লাইড দেখতে পাচ্ছি না স্যার।
ও আচ্ছা আচ্ছা আচ্ছা, তাহলে ক্লাস শেষ হয়ে গেছে না? ও হো, আচ্ছা আমি বলি তাহলে, আমি বলি, তোমরা নিজেরাই দেখো। ট্রু ক্যাপসুল আর ফলস ক্যাপসুলের মাঝখানে থাকে হচ্ছে কি? ভেনাস প্লেক্সাস। তাহলে আঙুলটা ঢুকিয়ে আমরা যদি এরকম করে, যে আমি বলেছিলাম কমলার মতো, জাস্ট লাইক অরেঞ্জ, আমরা যদি কমলার কোয়া আর কমলার খোসার মাঝখানে আঙুল ঢুকে একটা মোচড় দিই, তাহলে কি হয়? কমলাটা খুলে চলে আসে না? দ্যাট ইজ দ্য প্লেন অফ ইনুক্লিয়েশন। ইনিউক্লিয়েশন মানে হচ্ছে পুরোটা জিনিস ধরে তুলে ফেলা, নিউক্লিয়াসটাকে তুলে ফেলা। এখানে মনে করো প্রোস্টেটসটাকে নিউক্লিয়াস। এখন বুঝতে পেরেছো প্লেন অফ ইনিউক্লিয়েশন জিনিসটা কি? কিন্তু থাইরয়েডের ক্ষেত্রে এটা করা যাবে না। থাইরয়েডের ক্ষেত্রে থাকে হচ্ছে এই ট্রু ক্যাপসুল ফলস ক্যাপসুল, বাইরে থাকে হচ্ছে গিয়ে ইয়েটা, মানে ভেনাস প্লেক্সাস। সুতরাং ওইখানে এইভাবে কেটে আনা যায় না। এইটাই পার্থক্য, মানে এটাই বলছে ওরা। এবং এটা আমরা যখন থাইরয়েড পড়বো তখন আমরা দেখবো যে এখানে হচ্ছে ইন বিটুইন দ্য টু ক্যাপসুলস হচ্ছে ভেনাস প্লেক্সাস থাকে, আর ওখানে আউটসাইড থাকে। যার ফলে এই ক্ষেত্রে এই সুবিধাটা আমরা পাই যে আমরা আঙুলটা ঢুকিয়ে এইভাবে মোচড় দিলে আমরা আস্তে করে সবটা নিয়ে চলে আসতে পারি। দ্যাট ইজ দ্য প্লেন অফ ইনুক্লিয়েশন। ইনুক্লিয়েশন আমরা চোখেও করি, আমরা এরকম যেখানে পুরো জিনিসটাকে ধরে তুলে নিয়ে আসা, সেটাকে হয় ইনুক্লিয়েশন। হ্যাঁ, বুঝতে পেরেছো? মানে হ্যাঁ হ্যাঁ হ্যাঁ, আচ্ছা, ওয়েলকাম।
Good afternoon, sir.
Okay, good afternoon. Thank you so
Sir,
much.
I have one question.
Yes, please.
Sir, during the procedure of intraurethral tramp, after the surgeon removes the metastasized area of the prostate, is there also a chance of excessive internal bleeding during or after the procedure?
Of course, but nowadays the surgeons are so cautious, and as they can see with the TURP means transurethral retrograde prostatectomy. So they actually have a camera, and they can see whether there is venous plexus or blood vessels around it, so they can avoid it easily. Just they take the part they want to take. Even if there is bleeding, there is also another thing that is called uh, curettage. I mean, that can ligate or curate the blood vessels. That means they can seal off the blood vessels which are bleeding. So this device has got three parts actually. One is camera, one is the cutter, and one is the one is the um, sealing of mechanism. So they can seal off these bleeding points. Okay, thereby the TURP, transurethral retrograde prostatectomy, is very bloodless bleedingless surgery, and it helps to uh, have a very early recovery by the patient.
Okay sir, thank you sir.
Okay, welcome. ওকে, ঠিক আছে, থ্যাংক ইউ, দেখা হবে ইনশাল্লাহ। আসসালামু আলাইকুম।
ওকে, ওয়ালাইকুম আসসালাম।
ওয়ালাইকুম আসসালাম।